To our knowledge, 21 deaths. A lot of those are tied to nursing homes here in Springfield. And God rest their souls, and my sympathies and prayers go out to the families. If someone passes, whether a Springfield resident or not, but they're in a Springfield nursing home, that goes under the city of Springfield. We continue our meetings, state delegation, which we spoke to via Zoom Friday afternoon. We continue our meetings with Congressman Neal on Tuesday mornings, and we continue our meetings with our city council on Thursday late morning. I'd also like to thank Pastor and Father Robert White of my church. Our parish, Our Lady of Mount Carmel Church, sent a wonderful donation from the church of $1,000. He indicated he heard my plea for our police and fire departments for PPEs and sent a wonderful donation of $1,000. We appreciate that. The plea is not going on deaf ears, which I appreciate. Anonymous, some more thermal infrared thermometers have come in this weekend, yesterday. I'm hopeful that I'll get my hands on some more this Thursday. So to that anonymous donor, and you know who you are, thank you very, very much for hearing my plea on that. We appreciate that. I also like to give an update on the Prime the Pump, which Director Sheehan, Tim Sheehan, will speak a little more specifically on, but that's another second phase grant, $500,000, and I'm hopeful that we'll have some announcements coming out as early as today. And we feel that we reached a good ratio to help out a number of businesses, but again, with that, you must be open or working remotely and continuing to keep your workforce on payroll, and Director Sheen will speak of the CDBG COVID-19 virus funding that we are putting forth. On the police department, Commissioner Clapper, which will speak a little more on it, but you could show the contrast of what our police department deals with day in and day out. They made an arrest on a recent shooting, but a memorial event where there was about 200 people and an AK-47 automatic weapon loaded, 30 rounds at that. And then you turn the corner and our brave and dedicated men and women in blue, 8-year-old Javier Figueroa, a birthday parade for him, Lieutenant Julio Toledo doing that. So you see the contrast of the highs and lows that our police department have to deal with day in and day out. She will speak about some significant arrests being made on dirt bikes, drag racing, and also a 12-year-old who was involved with a use of a gun, believe it or not. Thursday, I'll give you a little tease. Thursday, we will do the first time ever a sort of virtual graduation at our police academy, and Commissioner Clapwood will get into that. Late last week, we started discussions with my cabinet heads, and specifically Helen Carlton Harris, my Health and Human Services Commissioner, and Pat Sullivan, my Director of Parks and Facilities, about the reopening at the appropriate time of City Hall and public buildings to try to get to a sense of normalcy, but it will not be the old normalcy. You will see at the appropriate time that egresses, entrances, and exits will be very, very limited. We are currently taking temperatures at all our facilities. Every morning when I come in, a temperature has to be taken. That's to protect and preserve our workforce. Hand sanitizing posts you will see. You'll also see masks, plastic face guards, plastic gloves, plexiglass splash guards, and many of those things will be coming forward. On the business openings, and like you, I'd like to be able to open up yesterday. We are following and heeding the guidance of Governor Baker, waiting for blanket guidance and guidelines so we can get our businesses open as soon as possible, but they must be done, and it must be based upon health, science, and medical aspects. The worst thing we want to do is take a step forward and have a huge surge occur and not being able to handle it, and working with our hospitals. That's extremely important. Helen and myself have been working very closely with the governor, specifically Lieutenant Governor Polito, and also with MEMA and COVID-19 Director Tom Magnan, and of course with Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, and Dr. Robert Ruse, the Chief Medical Officer of Mercy Hospital, to testing, to move along this testing, not only for our homeless population, but for the population of Springfield. Prevalence, we'd like to get to 30%. I know Dr. Kerouac will speak about the antibody testing that they're doing. We're also working with Caring Health Center on that for the testing. And I know Dr. Kerouac will mention about the High Street and Carew Street facilities that are expanding their testing aspects. But we like to get this done ASAP, and we're going to continue to get as many test kits or test machines that we can, whether from the feds or the state. We'll work with Congressman Neal. This past Friday or Thursday, I believe Helen and I issued strong statements pertaining to wearing masks, especially when you're out in public and going to the stores. Commissioner Helen Carlton-Harris did visit some stores. I've been in some stores too, and where Big Y has done a very, very good job. Walmart had sent me a communique that they're following all these guidelines. Well, they're not, or they're not doing a good job. And Helen was there, and subsequently health inspectors will be out there. I know they're not open today. Hopefully they heard that message. And also to the CVS's and the Walgreens and the Stop and Shops and other grocery stores, we need partnership here. So we need you to be able to tell your shoppers. Now, some have health reasons why they can't. That's understood. That's in our guidelines. But not only for the protection of yourself, but for others. Yeah, and when I'm out and about, I do wear that mask. And you should wear that mask. We all have to be in this together to stop that tide. I think Helen will touch upon a little bit of mental health aspects, or maybe Dr. Kerouac or Dr. Ruse. This has been a tremendous wear and tear of tension and stress to each and every one of our families, and how we need to deal with that. Helen will also be announcing a new campaign, Beyond the Walls. It's going to take more than City Hall to defeat this virus, which we will. We need the partnership of neighborhood organizations, nonprofits, and other organizations to partner with us and get the word out. Superintendent Warwick indicates to me, and he'll be speaking briefly on a few subjects, we have served in 17 different sites, including our homeless children, whether in homeless shelters or homeless shelters who are not in the city of Springfield. 382,854 meals have been served. Nearly 400,000 meals have been served. Breakfast, lunch, dinner, and snacks to our student population and their families, and really anyone that comes to those 17 school sites. The laptops continue on that. Superintendent will speak about grading aspects that are going to be going on. He'll touch upon state is now going to be working on remote learning. And we have a school committee budget meeting we'll do via Zoom Wednesday evening, Dan, and a regular school committee meeting via Zoom Thursday. And then we're exploring what can or cannot be done realistically when it comes to graduation. Dan, Superintendent Warwick's looking at different type of aspects on that. Director Signoli at DPW, we are at full strength. The Oasis Food Bank that we're working with and that's being run out of Central High School with DPW helping out, and Commissioner Clapprood, Police Department also helping out, John Foley. They have served, it jumped 1,000, 3,309 individual families have been served at that food bank, the Oasis Food Bank. That's a food bank of Western Mass, and Mr. Foley buys a tremendous amount of food for those families and individuals in need. Very orderly done at Central High School, lining up at Smead Arena. DPW continues to go out to do road work. Construction is going on and potholes. As far as our financial stead, again, we've lost $2.3 million in revenue. We have spent now $4.1 million in lots of schools, laptops, the PPEs, and also continuing to provide for our homeless population, which is extremely important. They're very, very vulnerable. So I know this continues to go on. We're very hopeful that we see a light at the end of the tunnel in the very, very near future. But we still need your partnership. We still need you to do the simple things that might seem very common sense, but to wash your hands, to wear those masks when you're out there, out and about, especially in a store. The social distance, that 6-foot social distance thing is important. If you don't feel good, stay home. Stay home. And that's extremely important. The other thing, too, is I want to thank, from cabinet heads down to my rank and file, they have done yeoman work. A lot of stuff you'll see is behind the scenes that is being done, but they're here day in and day out to move the city of Springfield forward for each and every one of you. For those who have lost loved ones, again, my deepest sympathy and thoughts and prayers. It's always difficult to lose anybody anytime, but under these situations, it's doubly tough. With that, I'm going to, very happy again to have Dr. Mark Kerouac, who is the President and CEO of Bay State Health Systems, and Dr. Robert Roos, again, who is the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, to address what all the efforts they're doing. And I can't say enough about all your frontline people, your doctors, your nurses, your custodians, your CNAs, you name it, what you're doing on it. And I also, in the partnership, it's worked out very, very well. I'm knocking on wood now that if a surge was to occur, both hospitals could handle that. And that's, I think, a lot of the precautionary things that we're doing moving forward on that. So without further ado, I will bring up the President and CEO of Bay State Health Systems, Mark Kerouac, and we're also joined by Patrick Leonardo of AMR, who's also here too. Dr. Kerouac?
Well, thank you, Mr. Mayor, and good morning, everybody who's tuning in. Appreciate your leadership in this crisis, Mr. Mayor, as well as Commissioner Carlton Harris and your whole leadership team. It's been really important for us not only to get regulations promulgated, but also to make sure they're followed, and your leadership in that is much appreciated. In terms of the numbers at Bay State, these will be released at noon for this morning, but at a high level, we've tested over 5,000 people, and half of those tests were done just in the last 2 weeks, suggesting that we've really been accelerating our testing capabilities. There have been over 1,000 positives and about 4,000 negatives. About 20%, therefore, have turned positive, and that rate is falling because of the fact that we're now testing in wider and wider circles in people who are less likely to have the illness, and that's really where we want to go, and we want to keep pushing on that. There are now 5 sites, 5 drive-through sites for testing throughout the Pioneer Valley in Greenfield, Westfield, and Ware, and 2 here in Springfield, one on Carew Street and one on High Street, to try to address and catch any kind of hot spots before they spread back more widely. And so that any patient with symptoms and with a doctor's note can get tested there by appointment. And of course, we're also doing first responders there as well. Yesterday in the hospitals, all 4 hospitals across Bay State Health, we had 126 inpatients. and 17 people under investigation. That's down from 179 earlier in the month, and it's been below 130 for more than a week. So basically, we continue to see a decline, and the numbers of people requiring ventilators or in intensive care has declined by more than a half. And I know this trend has been replicated by other hospitals in Western Mass. When this disease first appeared, we closed down for elective operations and procedures and built out new bed capacity in fear that a surge might happen, but right now we're only using 40% of that capacity. So we feel very comfortable that if a surge came again, we would be ready to expand. The 40% compares favorably to Boston, Greater Boston, which is at 70%, and so they're much higher and much more at the peak of their surge. Things are settling down a little more quickly out here, which is a good thing, and we're again hopeful that those trends continue. We are taking care of about 350 non-COVID patients, so moms having babies, heart surgeries, cancer surgeries, et cetera, and these are being cared for safely in separate areas in all of our 4 hospitals. So one of the public service messages that's gone out among the CEOs of Western Mass as well as providers in the eastern part of the state is if you are sick and sick enough to go to the hospital, don't wait because you're afraid of COVID. We are seeing people with more advanced heart attacks and strokes and even perforated appendix situations because people have been waiting too long and concerned that the hospitals aren't safe to go to. And I know that all the hospitals of the area have taken great pains to segregate the infected patients from the uninfected ones so that it's still safe to get routine care at the hospital. We're also working with local nursing homes to make sure that any hotspots stay contained and don't spread into the general population. We're dialoguing with their medical directors to make sure they have enough PPE, enough testing, and are following appropriate infection control approaches to segregate the infected from the non-infected. We're also working with community leaders, social service agencies, and our outreaches from our accountable care organization here in Greater Springfield, which is our 3 clinics plus Caring Health plus Health New England, to make sure that vulnerable patients know what to do and they have what they need to follow social distancing. This is more of a challenge in a vulnerable population because folks may have difficulties with either crowded living conditions, housing insecurity, food insecurity, transportation issues, et cetera. As the mayor noted, we are awaiting guidance as to when we can open up to greater activity as a health system or as an economy. I'm not going to say get back to normal because I don't think that's happening anytime soon. Some general guidelines have been issued by the federal government, small little baby steps, taking things a step at a time, pausing to see if cases spread after a given step. But different governors have taken very different pathways, as you've probably seen on the news, some very liberal and aggressive, others very conservative. Governor Baker is expected to announce his guidelines, but again, I'd keep in mind that things are much more at their peak in Greater Boston, and I'm sure he'll be influenced by that experience. To me, the key issue is not so much the magical date when we all start to open up again, but what are the conditions we need to open up safely? And those would include having enough PPE and having enough extra beds in case a surge does happen, having enough testing to make sure that we can keep hotspots contained, and having enough contact tracing so that when we do find a positive case, we can phone up the folks that have been around that case to make sure that they get tested and know what their status is as well. And so we look forward to working with the city and with other local officials to make sure that we can do as much testing as possible and make it as convenient as possible, and hopefully even broaden it beyond what we're doing today. As I said a few moments ago, I really don't expect a return to normal anytime soon. I suspect that a lot of the things we took for granted back a few months ago are going to be changed by some form of social distancing, whether it's going to a restaurant or a gym or a concert or a ball game or whatever. We will hopefully be starting to take baby steps toward getting back to more activity soon. And I look forward to working with the community leaders in doing that. So thank you for inviting us again, Mr. Mayor, and giving us this podium. And thank all of you out in the community for all the work you've done to keep the epidemic here in Western Mass in a manageable level.
Thank you, Dr. Kerouac. And to your whole team at the Bay State Health Systems. Also, just want on police and fire. Police is down. Commissioner Clapperud earlier this morning told me they are down 6, and Commissioner Calvi from Fire Department told me they are down 9. Once again, Dr. Kerouac and Dr. Russo will be available immediately after my city cabinet heads give their updates for any and all questions so they can get back to their important needs that they have to do at their respective hospitals. Dr. Kerouac, absolutely right, and I'm sure Dr. Russo hit on it. As far as the testing capacities we have to show in order to get public confidence, business confidence, consumer confidence, that we're able to identify hotspot areas, be able to isolate those hotspot areas, be able to community mitigate those areas, be able to contact trace those areas, and just as important, be able to heal those areas and individuals. That will give the full confidence of getting back on our feet. So we are working hard with the state officials, we're working hard with our hospital officials to get this testing going. I know that Dr. Kerouac about antibody testing, but this contact tracing, but to get it out, especially in our neighborhood clinic areas and other areas, as much as we can. 30% prevalence would be very, very big. So we're moving forward on that, and with that, deeply appreciate that Dr. Robert Roos, the Chief Medical Officer for Mercy Hospital and Trinity Healthcare, is here to give their perspective and our continued partnership with the city. Dr. Robert Roos.
Well, good morning, everyone, and thank you, Mayor, and all the commissioners for all your continued hard work and leadership as we address this pandemic here in our local community. Last week, I reported the overall sentiment at Mercy Medical Center was one of hope and promise. Hope for a continued slowing of the rate of transmission in our community, and a promise to you and your loved ones that we as a hospital are always ready and prepared to care for your important healthcare needs. And today I'm pleased to report that that has not changed. In fact, over the last week at Mercy Medical Center, we have crossed some important benchmarks. We've now performed more tests for COVID than we have in any prior week to date. And that means that we have now performed 4,303 tests with 1,409 positive test results and nearly 3,000 negative. We've also seen the percentage of positive test results slowly decrease as well, with this past week now below 30%, with a high in the past at over 40%, as many of our tests are coming from our community's long-term care centers. We've also seen the numbers of hospitalizations among suspected and confirmed COVID cases continue to decline over the past 3 weeks. And as of this morning, that number is right around 32, after a high of between 50 and 60 at the beginning of April. In addition, the percentage of patients with confirmed or suspected COVID hospitalized has declined to now below 40% of our total inpatient medical surgical volume. That is not including patients in rehab, patients in behavioral facilities, or women delivering babies in their newborns. And when all of our inpatients are represented, the COVID patients actually now make up less than 20% of our total patients receiving inpatient care. And so this week, our focus at Mercy is not only on the hope and the great stories of recovery that have come with treatment, but it's also on recovery and ensuring the safe and slow resuming of certain types of care in what will become the new normal way of practicing. The World Health Organization describes 3 phases of a global pandemic to inform how we assess risk in a community: the preparedness phase, the response phase, and the recovery phase. The preparedness phase is the time in which, in between pandemics, or just after a threat has emerged, where the plans are made and the resources are coordinated and the restrictions and the guidelines begin to be implemented. This was the work that was ongoing before we ever heard of SARS-CoV-2, but intensified after the first few cases were reported in the Wuhan province of China. And then, as the surveillance continues and the infection spreads like the novel coronavirus did, the pandemic surges is when the response phase comes into place, where health services are expanded, staff are deployed in new areas, and treatments are both developed and delivered. And this has been the focus of all of us over the past several months, with the expansions of testing, with the increases in bed capacity, and with the deployment of innovative strategies to treat COVID-19. But the third phase, the recovery phase, is this transitional period when the infection still exists, but it has slowed the rate of transmission, and the intensity has decreased, so that preparations can now be made to resume certain types of activities while ensuring that we can safely and securely monitor and continue to track for future infections or a surge of the current one. At Mercy, we've been preparing for and are suited for this recovery phase. And there are several benchmarks that we're using to guide our measure of that. First, capacity. We currently do have the capacity to care for both COVID and non-COVID patients, as mentioned. In fact, as stated, the majority of the patients we're treating right now are for non-COVID related conditions, like abdominal pain, fractures, cancer, those women delivering babies and their newborns. And our hospital is far below half its total maximum surge capacity. Second, care protocols. We've instituted new locations, new procedures that keep COVID and non-COVID patients separate and distinct. We have an entire floor of patients that are non-COVID. We have separate elevators and separate walkways so that staff can focus on those patients with the type of protocols that will best deliver care, so that we can reduce any potential risk of transmission to be virtually non-existent, as safety of colleagues and patients comes first. Third is testing. We have worked hard to expand our testing so that we have the ability to test all patients that would be coming to Mercy for any procedures. And we're taking extra precautions to ensure that we check for symptoms amongst our colleagues and employees, and having anyone in the facility wear a protective mask. Fourth is supplies. We are ensuring that we have a stable supply of all the equipment that we need, including masks, respirators, gowns, gloves, and eye protection. We are, like all other hospitals, dealing with a global shortage that has impacted the supply of gowns, but we are focusing on actively sourcing alternatives as we speak. And fifth, we're engaged in those critical efforts to be able to monitor for potential outbreaks, including testing of the homeless and supporting our long-term care facilities. Those 5 elements, capacity, care, safeguards, testing, supplies, and community monitoring and contact tracing, are the guideposts for us to move forward, as well as the warning signs if we need to scale back. These are unprecedented times, and we've talked about taking those baby steps. And we need to ensure that any step forward is one that moves forward safely. On a personal note, as a father to a nearly 9-month-old who's just taking his first steps and earning his first few bruises, I know how important it is to learn from experience and provide those safeguards so that every step lands successfully, so that we're all off and running before too long. At Mercy Medical Center and all of our affiliates and throughout Trinity Health, we take great pride in continuing to transform the way we operate to best meet our community's needs. That's been the legacy of the Sisters of Providence for over 150 years, and one that's being demonstrated day in and day out with our colleagues as we respond to the COVID pandemic and help our community recover in safe, effective ways. So while I continue to emphasize, as the mayor and Dr. Kerouac and others have and will, this is not the time to unwind the tremendous public health efforts that are flattening the curve here locally, like physical distancing, hand hygiene, wearing masks in public, and limiting large gatherings. And I want to recognize the tremendous work of Commissioner Helen Colton Harris and her team. They have done wonderful work. And it's important that you know that we are here and ready for you, and ready to prepared to care for all your healthcare needs. As a physician, I do remain concerned that there may be people at home with serious or chronic illnesses that could be delaying or avoiding care due to fears of COVID. Ambulance volume and traffic is down. Emergency department volume is down. But when we look at other cities and towns that have been impacted by this, we've seen things like heart attacks and related fatalities to those go up. As someone who also specialized in the treatment of addiction, I also know that recovery is a process. And taking those baby steps, those slow steps forward over the coming weeks to months is something that requires the support of all of us, and will be guided by the collaboration of all of us in government, in business, in public health, in our community, in every resident. And it will require resilience from all of us. Our worlds have changed from this pandemic, and it will be a long time if we ever truly enter a post-COVID world, as I've said. But the time is now to prepare for that prolonged recovery period. While the new normal may look different and it will feel different, we know that that new normal will have some of the same elements that you have come to know and trust and deserve: safety, quality, compassion, and that healing spirit. Thank you.
Thank you, Dr. Roos. And you should see the baby with the onesie, the lab coat, and the stethoscope, too. And tell Sister Caritas to appreciate all the prayers, too, on that. As Dr. Roos had alluded to, my elegant and eloquent Commissioner of Health and Human Services, Helen Colton Harris, like all my cabinet heads and rank and file, but she's really done a yeoman work on dealing with this COVID-19 coronavirus. She will now give an update and her perspective, and I also think, as she usually does, she will not mince any words on the continued direction we must go. Springfield Health and Human Services Commissioner Helen Colton Harris.
First of all, I want to acknowledge that I'm one of those individuals who has a difficult time breathing in a mask. And I know many of you in the city have reached out to me and expressed the same concerns. But it is critical that when you are in public places, that you do have on a face covering. Let me start by saying how very proud I am to be a resident of the Western region. We have two amazing hospital systems who have both told you that they have capacity. They do not want us to stay home, be ill, and not use our hospitals for services. It is critical that we follow through and take care of all of the parts of our health. Please do that. Please visit your hospital should you need to. Individuals with chronic diseases and underlying health conditions particularly need to make sure that they are doing telehealth with their physicians and visiting the hospital when necessary. In the city of Springfield, in Hampden County, there are 3,229 positive COVID cases. Last week, I stood here and I told you that there were 797 positives in the city of Springfield. I am here to tell you that number today is 1,180. That is an increase of 283 positive COVID cases in the city of Springfield. In the state, there have been 2,899 deaths, and that number is up 1,000 since last week. 55.6 of that, are recorded as Hispanic, 5% recorded as Black, and 33% recorded as white. 51.6%, though, is unknown or missing. And I tell you that to say we really don't have a true ethnic picture of race and ethnicity for those deaths based on the large number that is unknown or missing. Our long-term care nursing facilities, as was mentioned, continue to be areas that we are concerned about. There were 1,632 deaths amongst our long-term care and nursing facilities. That is 56% of all deaths in the Commonwealth of Massachusetts. Right now, Hampden County's death rate is 69 per 100,000 population, making Hampden County the highest death rate in the Commonwealth of Massachusetts. So when we ask you to work with us for the mitigation efforts that we propose, it is for a reason. Let me stop and thank Jason Mann, again, our GIS person, who does an amazing job in helping me. I am going to try to walk over to the map. Maybe I won't be able to do that. I'm going to walk over to the map because I think that it is important. Thank you, Carolyn. And so, as you can see by this map, our high-density areas are those areas that we talk about as far as the city is concerned. The zip codes, 011, 03, 04, 05, 07, 08, and 09. Those are highly density areas where individuals live and live pretty closely together. And so we recognize that when individuals are close together, social distancing and other factors do come into play. And so we know in these areas we're seeing increases, and also there are long-term care facilities in these areas. But look at what's happening in our outer areas as well. So it's not just these areas that we're concerned about. We're concerned about the entire city of Springfield. Every zip code in the city of Springfield is represented on this map. This virus is really not discriminating geographically in terms of who is being impacted. Where we're seeing the increases is in those high-density areas. And we know that communities of color, people who are marginalized, underserved, oftentimes live in some of these neighborhoods. We want to pay specific attention to those individuals and care about their health outcomes. This is important to me as well, and again, thank you to Jason, because what this does is shows you that even though our numbers are over 1,000, there are 717 unique places in the city of Springfield where there is a household or individual who is impacted and has a positive COVID-19 test. This is critical to note. That is the combination of all of those dots that you're seeing on the map. So we want to, as a city, acknowledge that we are all in this together and everyone is impacted. I want to talk about homeless testing for a moment, just because we were geared to begin the homeless testing last week. We ran into a barrier, but we do anticipate we will resolve it this week. It is not insurmountable, but we certainly are concerned about our homeless population. So I want to just acknowledge that that is not something that we have forgotten about or take lightly. The mayor and I will continue to work on making sure that we are getting the testing done. I also want to answer a couple of questions that have come over our hotline. One is, where can I get tested? Currently, it's my understanding that there are tests that are being done for individuals who are symptomatic. Asymptomatic individuals or individuals without symptoms right now are not being tested broadly. We believe testing asymptomatic is important so we can really understand the prevalence of the virus in the city of Springfield, because what will happen is we will continue to reinfect each other unless we understand how widespread it is. Where can you get tested if you are an individual with symptoms? I think Dr. Kerouac has explained the process to you. You will need a physician's note, but you can get tested if you have symptoms, and that's really, really good news. Another question that you ask is, can the Department of Health and Human Services give me a mask? No, we do not have masks to give to the general public. We're calling them face coverings for a reason. You can use bandanas, you can make them yourselves. There are creative things that individuals are doing to use face coverings. Some of them are in this room. And so there are ways that you can make your own, buy your own, and it's just important that you do cover your face. And another question we got, I heard my neighbor has COVID-19. Can you tell me who they are? No. The HIPAA rules dictate that we cannot tell you anyone who is positive. We do give addresses to first responders. They are the individuals who have information. What we did do was do this map and give you some zip codes with no streets, and that was intentional. We don't want to put streets on there. It is important that we give our first responders what they need, but that we protect the confidentiality. We will begin in the city of Springfield, beyond the walls of Springfield City Hall, and it is stop the spread of COVID-19. What we recognize as a municipality is that we cannot do this by ourselves. We are so grateful to those individuals who have stepped up and stepped out. We see them every day, those everyday heroes who are out feeding first responders. They're in their neighborhoods spreading the word. They're giving food to individuals who need it. But we cannot get this message out alone. So we will be asking you to join us. I've heard from, example, Partners for Community Action asked if they could go up and down the streets with a megaphone and just announce the tips around keeping yourself safe. And I thought that was great. So things like that will really help us get beyond the walls of Springfield City Hall and stop the spread. You will hear more about our campaign as time moves forward. Finally, I want to thank the staff of the Springfield Department of Health and Human Services always, in conjunction with the Springfield Public School nurses, have done over 700 contact tracing. We will be working with the state as our numbers have risen to ask them to assist us as well. But we will maintain local control of our process. That's very important. Also, I want to make sure that I am thanking those individuals who are first responders, who are out on the front lines, the grocery store workers, the hospital workers, the individuals who drive the bus. There's so many of them who are doing an amazing job. And so as we move forward, we ask you to continue to help us with our mitigation and response plans. One last thing, cabin fever, mental health. We are all feeling cabin fever, I think. And we are feeling it because we have been asked to stay inside. So many of us are depressed. Many of us are concerned about each other. Many of us may be participating in behaviors that may not be good for our health, but it's important, take breaks. This is unusual times, and all of us are nervous. All of us have fears. All of us are concerned about the future. Saving our mental health is something that we have to do on an individual basis. So I encourage you to talk to each other, unplug from the television, take a walk if you can, talk to somebody about how you're feeling. Go outside in your backyard as I did and just scream to the woods or scream to the neighbors, but get it out. Try not to internalize it to the degree that you can. Work with your own internal mental health system and your family. Finally, I would leave you with an African proverb, and it is, when spider webs unite, they can tie up a lion. The lion in this case is COVID-19. We are the spider webs. If we do our job, if we do those things around social distancing, washing your hands, wearing a face covering, covering your mouth when you sneeze, if we do that, we can tie up this lion, COVID-19. Thank you.
Thank you. Thank you, Commissioner Carlton-Harris. Yeah, there was a call out to your area there about a loud scream, but Commissioner Clapper indicated that it was unfounded, everything was okay. I also want to thank our sign language, lovely young ladies that are here. We have what my father would say up in heaven and Eddie Pakula would say down here, a trifecta, a winning trifecta of 3 young ladies here, and I deeply appreciate that. Commissioner Carlton-Harris indicated about people calling up wanting to know exactly where people have COVID-19 coronavirus. This is not about a scarlet letter. Nobody did anything wrong. And this is when we should be supportive of each other and not shun people away. You see in Bay State Medical Center the Rocky theme that is played when patients recover and they leave the hospital, both at Mercy and both at Bay State. So there's no need to be a scarlet letter at any time pertaining to this. Nobody did anything wrong. As far as the mask, the face covering is very, very easy to make. And I gotta be honest with you, whether it's governors or mayors across the United States of America, we've had to cannibalize each other when it comes to supplies. We have had to go out and order as best we can, pick up wherever we can. I can't say enough about the private sector and our business sector. When I made that call, maybe 2 weeks ago, donations are still coming in. And that really shows the pride of the city of Springfield. That's extremely important. And speaking of the pride of the city of Springfield, the pride of blue, I will now bring up our Police Commissioner, Cheryl Clapper, and she will give you an update pertaining to our police department's continued activities to keep each and every one of you safe and sound. Police Commissioner Cheryl Clapper.
Thank you, Mayor. Good morning. The police department, as of today, we're down 6 due to the COVID virus. 14 of my officers who at one point tested positive are back to work and back in our workforce. We were busy. We stay busy. Last week alone, Monday, we made an arrest on a traffic stop of a man with a gun. This person had been arrested in Chicopee in January by Mass State with a gun also, so he was out on gun charges. Tuesday afternoon, we made an arrest of Eddie Banks, wanted for murder in Brooklyn, New York. He's going to be extradited back. Thursday morning, we arrested a subject for an attempted armed robbery with a gun. He also has prior firearm charges on his record, and Saturday, being the nice day, we were very busy. About 200 individuals gathered. They were marching in memoriam for the College Street murder victim, and the memorial was taking place near Cottage Street and Codwell Drive. They were being moved along as a group in unison, and the officers, led by Lieutenant Brian Bellevue, Lieutenant Ariel Toledo, Lieutenant Julio Toledo, took notice of 2 subjects acting differently and suspiciously, and they located a 30-round loaded AK-47 after conducting the traffic stop of them at Bay and Roosevelt. Again, since March 23rd, 12 illegal firearms have been seized in the city, and most of these firearms are of high capacity. Saturday, we also got calls of a large group of people who were riding around on dirt bikes, illegal dirt bikes, ATVs, and they were stopped at one point on Allen Street. We did make an arrest of a subject on an ATV, and that dirt bike, and that was seized, along with the dirt bike was seized. We also continue to participate in as many celebrations as possible. It's good for the officers, it's good for the community, it's a good way to make friends with everybody and let people know that we care. We're doing the good things as well as doing our jobs. We participated in a couple of birthday parades. Again, this afternoon at 3, we hope to participate in a celebration of a healthcare worker who has defeated COVID-19. Being released from the hospital, we will participate in that celebration for her also. As the mayor mentioned, also Saturday night there was a drag race organizing on North Main Street, about 50 cars getting ready to drag race. Officers broke that up, and we made 4 arrests on that. The mayor mentioned a graduation. We are ready to graduate those recruits who are in the Springfield Police Academy. There's 34 from Springfield and 10 from surrounding towns. We're working on a location, and we hope to do it virtually, 2 groups, maybe stream it live on Focus Springfield and also do it live on Facebook so that their family and friends can see the graduation. It's something to be proud of. They have been in the academy since December 2nd, so they will be coming out Thursday. Other than that, Mr. Mayor, we continue to serve and stay busy, and we thank you for your support.
Thank you, Commissioner Clapper. Thank you, and the men and women in blue, and I also want to give a shout out and thanks to all our media members that are here in Focus Springfield for your partnership. It's important that we get this information out to show what we're doing to deal with the challenge, how we're going to give you updated information, how we're going to beat this thing, and just as important, to share good news too. That's extremely important. And speaking of good news, Commissioner Bernard B.J. Calvi, the Commissioner of Springfield Fire Department, has done a tremendous job and with our brave and dedicated firefighters. So he'll now come up and give you an update. Springfield Fire Commissioner B.J. Calvi.
Thank you, Mayor. Good morning, everybody. The weekly update from the fire department is as follows. We currently have 9 members out. 2 of these members have tested positive. The other 7 are in self-quarantine. We're expecting 4 of those members due back this week. The low numbers are due to the team effort from the command staff down to the newest firefighter on the job. All the fire stations are doing an outstanding job with cleaning, making sure everything's sanitized. The building maintenance people that come in are doing an outstanding job in the stations every day, coming in using the atomization guns to sterilize the stations. You know, Pat Sullivan and your team, we can't thank you guys enough for that, helping to keep us healthy and on the job. Our call volume is down this month. Thank you to the citizens of the city for that, being cautious and making sure fire dangers are kept to a minimum. Due to that, it's easier for us to self-distance, because when we go to fires, we can't self-distance. Everybody's on top of each other. So thank you to the citizens for that. Like I said, our call volume is down, but we're still here for you. We're open every day. We've been able to participate in several parades for children having birthday parties, and at the hospital, we participated in a parade over there. We want to thank the community for all you're doing to help us out with meals that are being dropped off at the fire station and all the goodwill we're receiving from the community. Again, thank you to the mayor for all his support in ensuring that we've gotten all the appropriate protective equipment that we need to make sure we can do our jobs. Our partnership with the police department, we're talking every day just about making sure we're sharing PPE back and forth and making sure both departments are taken care of. And just my final thanks to the men and women of the Springfield Fire Department, the chiefs, the officers, the firefighters. Everybody's doing an outstanding job, and we're coming through this together. Thank you very much.
Thank you, Commissioner Calvi. Thank you, Commissioner Calvi. We continue to move forward, and I really want to, with our school system, and I really want to thank Superintendent Dan Warwick and his team. They've done a tremendous job in with all of us trying situations, and he is now going to give you an update pertaining to our Springfield public school system. Springfield Superintendent Daniel Warwick.
Thank you, Mayor. As the mayor said earlier, we're up to almost 400,000 meals that we've provided for our families since the beginning. We have 17 locations throughout the city. We're doing breakfast, lunch, dinner, and a snack for every family every day. And on Fridays, we hand out the meals for the weekends. We've also added all the homeless shelters, so we're delivering to our kids in the city and out of the city, but still part of the public schools, in the homeless shelters to expand those services. Now that we know we're out of school for the rest of the year, the state has added guidance, and we're going to be expanding our remote learning plan. So we'll be working with our staffs in the schools to hit the power standards in the curriculum so the kids will be ready for next year when they come back. Laptops, we have laptops still available at all the schools. Any parent who didn't access that opportunity, and we've distributed 17,000 already, can contact their school, and there'll be a laptop for them, either for pickup or we can arrange a delivery for the laptops. We're working now on fourth quarter grading. We intend to grade students using a credit, no credit, which is a different grading system for this last quarter, but to make sure that families are engaged, kids are engaged, and we're actually going to give kids feedback on their work and put a credit, no credit policy forward to school committee on grading. So that's our update as of now. Thanks, Mayor.
Thank you, Superintendent Warwick. Thank you, Superintendent Warwick. He has to hop on another conference call with the state. I have to bring up for an encore presentation our Commissioner of Health and Human Services to once again put forth very strongly clarifying statement that was made on the federal level because she has received phone calls on our hotline that we have. Commissioner Helen Colton-Harris.
Good afternoon again. One of the important questions that was on the hotline on Sunday, there were 3 individuals who called in and asked this question. And the question was, does ingesting disinfectant kill the coronavirus? I want to just say to the public, and I'm sure that you know this, under no circumstances should you inject or digest a disinfectant or cleaning product. Please read the label of any of your cleaning products and you will see they are classified as poisons if you ingest or inject. But that is not a way to get rid of or do anything to the coronavirus. And you would think we would not have to say this, but people actually heard that statement and believed that there was some truth to it. Thank you.
Thank you again, Helen. And again, that shows how important, with each and every one of us, when something is said, people are just at wit's end. They're looking for any type of opportunity. And even though you think they might know better, they can be very trusting when individuals of authority speak. So it's important, each and every one of us, from the federal level on down, whether it's good or bad news, to be straightforward and speak what is concretely known and leave the medicine, the medical, the health, the sciences to the experts. That's what I do here in this case. So, Helen, I'm glad you said that because she received a number of calls on that. So please, no one inject anything of a disinfectant. Don't drink any disinfectants whatsoever. And that's important to put across. At this point in time, I will now bring up our DPW Director, Chris Signoli. And again, the DPW workers have done a tremendous job, unsung heroes. He or she are out there picking up the trash, they're filling potholes, they're doing roadway work, they're continuing the business of the Department of Public Works. So they are our heroes in our eyes too. So without further ado, the leader of Department of Public Works, Director Chris Signoli.
Mayor, thank you. At this time, the DPW department does not have any personnel issues with regard to the COVID. All employees are at work. Our construction projects are out to bid. Our annual paving contract, line painting, crack sealing, and the reconstruction of our Central Street project is out to bid. Major construction projects such as Six Corners has started, as well as some of our paving programs from last year. We've been working out on Mill Street and at the intersection of Mill, Belmont, Fort Pleasant, as well as Bristol Street and a few others. Yard waste is up to date, so we should not have any problems with that. Trash and recycling has been going fine. In the spirit of what Helen was talking about, we've received a lot of questions when we have had to tag a barrel that had illegal material in there. No, we will not come out and take that material out. The homeowner has to come and take that material out, and we will come back and get it. So if that's the case, take the proper material out or the illegal material out, and we will come back and pick up the trash and/or recycling. We've had a few issues with contractors working in the street without a permit. Permits could be anywhere from $75 to a couple $100. If you are caught working without a permit, there's going to be a big sweep this week. Your license will be pulled, and you will not be able to do any work this year. So trying to save $100 could cost you hundreds of thousands of dollars in the city of Springfield. So we're going to make sure that that does not happen. Lastly, there is a scheduled household hazardous waste day for next Saturday, not this coming Saturday, but the next Saturday. As of now, that is on. Residents will just be able to show up, open up their trunks. It is performed by a contractor of the city, not by the DPW. If there is any change in that and you have an appointment, you will be notified directly. But as of right now, that is planned to happen. If there is any change in that, obviously we will let you know right away. Other than that, Mayor, we are very good. Thank you.
Thank you, Director Signoli. Thanks, Director Signoli. Thanks, Chris. Just to let you know, too, it was a great day Saturday, and I noticed in my walking around the neighborhood after getting updates, doing paperwork, people are doing yard work. Just be reminded, again, we still do curbside pickup, but that curbside pickup for your yard work or those leaf bags must occur on the same day of your recycling. So, you know, we're going to have inclement weather and rain, and if you could keep those bags or that yard waste sheltered somehow or keep it out of the elements until it's your recycling day, So I know some will call, they didn't pick up my, they didn't pick up my yard waste. Well, if it's not recycling, they're not going to be picking up your yard waste. We appreciate you keeping your property nice and clean very much so. Again, as I always say, Springfield's in the business of being in business and making sure that whether large or small businesses continue to thrive even in these challenging times. This is our second phase. We were one of the first, I think we were the first out of Western Mass, one of the first in the state to put out literally $750,000, first for our restaurant fund and now for our small business fund. And the Chief Development Officer Tim Sheen and his squad have done a great job. We believe we might have some announcements as early as today. And he tells me the ratio breakdown is pretty good. But he'll clarify to you that your business has to be open and/or you got to work remotely or keep your employees on payroll, so there can't be a double dip in order to help the businesses that are continuing. We're bridging it right now. Prime the pump, we're bridging the gap right now. So when we get back on our feet to some sense of normalcy, you'll be ready to rock and roll. Without further ado, the Chief Development Officer of the City of Springfield, Tim Sheen.
Thank you, Mayor. Just to give an update on the restaurant round, which was our first round, virtually all of the recipients have advanced to contract, and the majority of recipients have received their first grant check. As the mayor indicated, we are in the second grant round that was open to small businesses. We advanced into this round with the understanding that we were going to award 2 businesses that remained open or those that were operating in a remote status but maintained their payroll. We are in the process of confirming some information with regards to the applications that we received, and hopefully we'll get that information back this morning. And as the mayor indicated, we're hopeful that we'll be able to make an announcement as to the recipients of those grants later this afternoon, if not first thing tomorrow morning. The other focus of my department is ultimately dealing with the money that was awarded to the city from the CARES Act. Roughly $3.5 million in formula-based grants were provided to the city. We're in the process of advancing that money through the approval process. Some of the funding requires public hearings. You might be seeing some of that. We are trying to get through that process as quickly as possible. HUD has actually reduced the notice requirement down to 5 days in terms of conducting the public hearing and having the notice provisions. We're trying to advance that as quickly as possible so that we can get the much needed money out the door. The focus of that money is basically for public services to deal with issues that have been COVID related, also to deal with housing issues that have come up with regards to COVID need. And then finally, there's a significant component that will be dealing with additional assistance to small business. Thank you, Mayor.
Thank you, Tim. Thank you, Director Sheen. Appreciate that. Again, Director Sheen and I urge you to take full advantage of what is being put across on the federal level. We appreciate Chairman Neal, Congressman Neal Ritchie for his continued efforts on the PPP and small business aspects. And there's guidelines that you have to follow there. Those are loans. I understand if you do follow certain criteria, they might be forgivable. Ours are grants, and we do, as Tim indicates, he mentioned CDBG and HUD. We have to follow those rules and regulations. So I appreciate Chairman Neal continuing to fight for us, as I do with Governor Baker, Lieutenant Governor Polito, and our state delegation on the state side to obtain as much funds as we can. With that, Pat Sullivan and his team, whether with the parks or specifically facilities management, these young men and women have done such a tremendous job. Again, now we are taking with the thermal infrared thermometers everybody's temperature, including my own, and where we are operating, to protect and preserve our workforce is happening. Cleaning is constantly happening. And now Patrick and Helen and the rest of my cabinet heads, we're starting to work on a reopening aspect of our city buildings and City Hall. We can't wait to see it. We're in the business of helping out public, and we love to do that day in and day out. So we're starting that process, and again, we're waiting guidance, blanket guidance from the state level, Governor Baker, on how our businesses can reopen to some sense of normalcy. So with an update, let me call the Park Superintendent and Director of Facilities Management, the Wizard of Oz, Patrick Sullivan.
Thank you, Mayor, and thank you for all your support. The residents should know the mayor asks us every day if we need any supplies or materials, and usually by the end of the day, they are delivered. So, Mayor, thank you for everything that you're doing. As we reopen government, I'll be working with Helen Colton and the rest of the team on protocols, and everyone should not be surprised. It will be a very slow opening. It'll be limited access. When you approach a building, as you enter, your temperature will be taken, and if it's not the appropriate temperature, you will be asked to leave. Hand sanitizer stations will be located as you enter the building and in the public office you are visiting. Safe social distance guidelines will be followed at all times. And at some point, it might even look like the Costco or the Home Depots. If the building has too many people, you will be lined outside of the building. Plexiglass shields will be installed and when necessary for the protection of the residents and the City Hall employee. As we've navigated the COVID virus, government work still continues. We are in the process of submitting the Community Preservation Act grants this week. I believe there's a public meeting scheduled for May 5th. We are also submitting state and federal grants for the Duggan Field, Forest Park, and Loon Pond. And we are about to complete $3 million, or start $3 million in school repairs since the schools are closed for the summer season. We are also completing construction projects at Ruth Elizabeth Park and Emily Bill Park, and we're very proud of the work of our both facilities and park teams to keep our city safe. Thank you.
Thanks, Pat. Thank you, Director Sullivan. I know that my CAFO, TJ Plant, and Lindsay, the award-winning Finance Division, 12th year in a row winning that governmental award from Independent Look on it. Again, we have spent, we've lost about $2.3 million in revenue and spent about 4.1 or 4.6 in expenses. We are working with GP Strategies, JP Strategies, Josh Norman, who was very helpful to us, the Rensselaer during the tornado days, to make sure we track every dime, and I'll fight, as I did before, to retrieve every dime we can from the federal or state level for the residents and business community of the city of Springfield. So I don't know if TJ has any other updates. If not, on the legal, thank you, Billy, on the legal aspects, or HR and labor director, Attorney Bill Mahoney is here, and my city solicitor Ed Pakula is here if they have any updates at all. And another very fashionable face covering you have, Bill. You had the Yippee-Yi-Yo-Ki-Yay one last week with Jesse James, and now you have the Red Sox one. Very, very good for opening day. So with that, again, I'm so deeply appreciative that Dr. Kerouac and Dr. Roos take the time to be here every Monday morning at 10:15, and we will continue this to tell you how we're defeating this challenge and maybe tell you some good news too. I know they have to get back. I deeply appreciate the media being here. If your first questions, please, could be to Dr. Kerouac and Dr. Roos so they can get out and about their day. So any questions for Dr. Kerouac or Dr. Roos? Audrey Russo from Western Mass.
One for both of you guys, given some of the stats that you gave us today and looking at some numbers from the state since the 23rd, the number of new cases each day appears to be going down. The hospitalization rate appears to be going down in the Commonwealth, and the number of total positive cases when compared to total cases cumulative, hovering around 23% of the 10th place after the 7th point, going down a little bit. And that's since April 19th. With those numbers, you guys have been mentioning that those are positive trends going downward.
Ultimately, the governor calls the tune, and whether or not he treats Western Mass differently from Eastern Mass is really going to be up to him. In terms of the number of days, think of the number of days somebody stays in quarantine before a new case comes up. So the federal guidelines have suggested that you let 14 days go by, and you'd like to see a steady downward trend for 14 days in terms of either new cases or hospitalized cases, or some combination. The governors are allowed certain discretion in terms of which numbers they pick to track. But every time that I've seen an interval suggested, it's been in about the 14-day range. I'm guessing that, you know, here in Western Mass, we feel we've kind of hit that 14-day run rate, but Eastern Mass has not. And so whether or not the governor treats us separately versus as part of a bigger state is at his discretion. There are different governors that have done it each different way.
And I guess just to follow up to that, when you say steady downward, that can even be like by as low as a fraction of a percentage point. Is there like a margin of error, I guess?
Yeah, I'm looking at, I look at hospitalized cases as probably being the most reliable indicator of overall disease burden in the whole region. Because of the fact that we've tested more and more, all of a sudden, we're finding a lot more cases. The question is, would those same cases have been there if we had tested, or would those same numbers have been there if we had tested 2 weeks ago? That's an open question. I think probably yes. To me, the criteria that we use to admit somebody to the hospital or put them on a ventilator, that really hasn't changed that much. And so the fact that those numbers are going down, to me, is a reliable indicator of overall disease burden. Not to say that it's not still spreading and not to say that we're through the woods, but I think the overall amount of disease burden is declining in the West. I mean, Rob,
So I would agree. And one of the great sort of areas of collaboration over the past 2 months has been all the hospitals being able to compare what our experiences have been on a daily basis, and we all share that same experience. So we have seen the peak of hospitalized cases in our hospitals in that first week of April. I think we all share that peak was right around between the 6th to the 9th of April, and then have seen that slowly decrease. From a hospital operations perspective, the other sort of benchmarks that we are looking at is that percentage of COVID patients amongst the entire hospital population. And now we've gone below 40% and approaching 30% when we look at our medical surge volume, which means that we have great capacity to take care of other patients.
I have one follow-up for you, Dr. Wilson, because I didn't catch it the first time. You noted a statistic of 32%, and I didn't catch what that 32% is in reference to.
So let me just rephrase that. The 32 that I think I referenced earlier was the number of confirmed or suspected COVID patients in the hospital, which represents less than 40% of our current medical surgical inpatient volume. When we factor in all of our inpatients, including mothers having babies, rehab patients, and behavioral patients, it's actually less than 20% of our total hospital volume.
Can you talk about your testing capacity? I know you said you've opened these electric sites now, but are you talking about what that means in terms of testing capacity?
Sure.
You have adequate supplies of swabs and reagents and things like that?
We are testing over 400 a day, tests being performed. It's roughly 80 per site. The site at High Street is below that because it just got started late last week. Currently, we are not short of any of those critical materials, but from my standpoint, we could be doing way more testing, as Commissioner Carlton Harris said. We'd like to be able to test, asymptomatic patients who would, walk in or whatever. You'd have a much better epidemiologic handle. We've really restricted testing because of the limitations of our machines and test kits. I'd love to double, triple, or even more the number of that we're doing, and we're pushing to do that and working with the city as one of our strategies there.
So what's standing in the way of doing that kind of testing?
I think that this is a brand new test. Some parts of the test are cumbersome. Compare it to, say, a strep test or a flu test, which is quick and can be done in any doctor's office. This is a test that looks at the genetic material of the virus, and it's collected by a long, skinny swab passed back through your nose to the back of your throat. And so because that's uncomfortable for some people, we need to gear up somebody in personal protective equipment. I know both Mercy and Bay State are looking at the possibility of swabbing the throat rather than the back of the nose. And we're all anxious to see a different kind of test come out that doesn't require us to look for the genetic material of the virus, but rather look for an antigen, which is a protein on the virus, which can turn around more quickly and more simply. So all of these things, because this is such a new disease, all these things factor in. We're kind of waiting for things that would accelerate our ability to do more and more testing, because we know from a simple numbers and containment game, we ought to be doing 5 to 10 times as much testing as we're currently doing today, not only in Western Mass, but as a country.
Somebody mentioned antibody testing. Are you doing any antibody testing?
Okay, started. We have not.
No.
We have not.
It's just gotten started, and again, this reflects the newness of the problem. There are 80 or 90 different vendors of antibody tests, and you need to really pick and choose to make sure that you're going to get reliable supply, but also accurate results. And we're working right now to make sure that we're going to pick the right one for the long run. That's going to be helpful in terms of the contact tracing, because if you go into a situation and try to trace contacts after people have recovered, they're not going to have virus there anymore, but they will have the antibody.
And those tests have to be FDA approved. Have any antibody tests been FDA
Yes,
approved?
yes, yes. There are other cities. Yeah, there are other cities in the country. I think, and I think both Boston and Worcester. So we're a little behind our friends in the central and eastern part of the state, but not too behind. We expect in a week or two we'll be up and running. I suspect you guys will too.
I think that's similar. I think the real caution that we have regarding antibody testing is ensuring that the test characteristics, the sensitivity and specificity of those tests are at a level that is going to give us the most accurate results. You can run into a very concerning situation if those characteristics are not. And if you are testing a population that has a low prevalence rate, and you don't have a high specificity and sensitivity, you can generate a very high false positive rate, which would give a very concerning impression to the public. So we are being cautious in terms of evaluating when those tests are ready, and then we'll take those steps when they're available.
Any other questions of Dr. Kerouac?
Yeah, you both said that your numbers include like cases that are unknown or under investigation. So this is kind of two-part, like A, what does that actually mean, and B, what is your turnaround for testing? I imagine that if you have a rather quick test, then it shouldn't remain unknown for fairly long.
I think that's exactly right. I mean, these are people who often would be admitted in the early hours of the morning, and they have the swabs done, they've been sent off to the lab, and it takes several hours for them to come back. So they're still in that unknown status. But the same numbers we report, and for us it's roughly like a dozen people every day, they're not the same dozen day after day. It's a different group.
So we can usually be assured that, like, I rely a lot on like the numbers the state puts out, which I realize are a couple of days delay to a certain extent on what's there, but those numbers that are the difference, because they group them together, the suspected, and there's not really going to be a huge change necessarily. There might be an odd person who's not actually positive that might be coming off of that, as well as just waiting for the next day for the test actually come back.
Yeah, there are rare people for whom the results are equivocal, but most of those we are advised to consider them as positive. But most of the time, it's just a delay issue.
I think that's right. Because we're representing results at a given point in time. There's always going to be a few tests that are still pending, and those persons are still under investigation. For us this morning, out of those 32, that's just 4. And then when those test results come back, they will be either positive or negative. I think as the state's data takes both into consideration, you could consider that now that testing has become more regular, that the trend would follow, even if the numbers may change by a few here or there.
And I wanted to ask Dr. Kerouac, there was recent reporting about the Bay State not having as many people on ventilators, which is kind of different than what you see in some other parts of the country, particularly where they would hit a little bit harder. Where did the decision come about to kind of look at how the disease is affecting breathing a lot differently than here as opposed to was out there?
Well, there were a couple of things. First, we weren't the first ones into the fight, so we realized from other places like New York and Washington that people who got ventilated had a very high mortality. I think that the initial New York series, it was north of 80%. We also had the good fortune of having a number of intensive care specialists who study acute lung injury called adult respiratory distress syndrome. That's their research interest, and they're part of multi-center investigations. So COVID is a kind of diffuse lung injury, and they decided to apply the same principles. What was different about these patients is that they might have very low levels of oxygen as measured by that little finger device. They might be at 80% saturation where normal is over 95, and yet don't appear very uncomfortable because they're getting rid of their carbon dioxide fairly well. Given that, the strategy was to flip them on their stomach, which opens up good lung in the back, and give them high levels of oxygen to breathe. And they found that that has enabled them to keep their overall ventilator use at about half the overall rate of the state. Now, they're not keeping that as first of all, that's nothing special. It's not like some secret pill that they're giving, right? Nor are they keeping it a secret. They're networking with other intensivists, and we understand that many of the other centers are now adopting this practice. So, we're happy to see that that allows people to, number one, avoid the ventilator, avoid the complications, and get out of the hospital sooner.
Any other questions or comments for Dr. Kerouac or Dr. Ruse?
Well, I just want one other one. I don't know if, I still maybe it's more directed to Dr. Bruce because your background's in behavioral health and psychiatric stuff. I mean, if you have any, comments about how, obviously, I think maybe we're staying a little bit with the next public health crisis because those might be a mental health one. Is there some sense about how your institutions, to the extent that you do deal with those types of issues, are preparing for what may be coming after people start unwinding a little bit?
So I think that's, we've been dealing, I guess I'll start, we've been dealing with an epidemic for both mental health as well as substance use disorders in our communities now for some time. And this overlay of COVID on top of that has added an additional element that has caused treatment programs and providers, I think, to transform how they deliver care. Because typically much of that care is delivered in group settings. It is delivered with face-to-face contact. It is engaging people in recovery support, 12-step meetings, et cetera, that now have had to either subside or change how they operate. That, I think, has been the first thing that we've seen change and really important, that people still have connections to the support through telemedicine, through telephonic support, through apps and chats on their phone that allow people to stay connected, albeit in different ways. I think developing that technology is something that certainly in our system we have looked to leverage and expand, as we know that people need to stay connected to those supports. Additionally, we've really looked at how do we build resilience, which is a key factor in terms of how people's outcomes when they're dealing with behavioral health conditions. And we have deployed teams both to support particularly our inpatient providers that incorporate behavioral health support and education and access to resources, so that when we have a team that may be dealing with patients with COVID that are feeling particularly stressed or at times can feel overwhelmed, or if we have staff that we're now working from home where they're more isolated than they used to be, we've developed models that we can deploy resources and support to those individuals as well. So I think it's going to call upon all of us to think differently, act differently, and ensure that we don't forget about those conditions that are present in our community.
Any other questions of Dr. Kerouac, Dr. Ruse? Again, I deeply appreciate them taking the time to be here on the phone anytime, but being here every Monday at 10:15. And I wish you and your families and your staffs and team good health too. So thank you.
Thanks.
Thank you, gentlemen.
Thank you.
I don't know if there's any other questions of my cabinet heads myself, but I think you heard from the doctors too. It's April 27th, I believe. And we're still having issues on trying to get proper supplies from the federal government down to the state government, down to the local governments. So it just boggles my mind that the Defense Act was not utilized well over 2 months ago. You heard it from the doctors, still with PPEs, the thermal infrared thermometers, which to my anonymous source, so again, you have mayors and governors cannibalizing each other to get supplies, whether for the city or for the health institutions on it. And again, we thought we were ready to go last week, Helen will tell you, but to really step up the pace on this testing. She and I have been very upfront and forceful with all the entities we spoke to, whether on the federal, state, or local level here, that we need to get that up and running, bigger numbers, and that way we get prevalence on it. So any other questions, my cabinet heads, myself, Paul?
I've got a couple questions.
Sure. Sure.
You said that on the question of contact tracing, when the state starts this big program that they've announced on May 1st with a 1,000-person call center, how is that going to work with the city's program? You say you're going to maintain local control, so can you explain how the entities are going to work together?
Sure. As of May 1st, CTC, the Community Tracing Collaborative, will begin their process of pulling cases from our MAVEN system, our infectious control system. We will need to check off the ones we want to keep, and they will then take the other ones that are not checked off. We know right now it's the opposite. So May 1st, they're going to grab all of the cases unless we say that we want to keep them. I anticipate that we will keep cases based on our ability. We have 2 nurses from Bay State Health helping us. We have 3 to 4 nurses, Springfield Public Schools, and internal staff of about 3 to 4 individuals. So we will keep a good number of those cases, but we will also have some go to the CTC.
How will you decide which cases you want to keep? What's the basis for that?
The cases that we will consider will probably be those that are in our high-density areas that we'll consider keeping. It is important to me, and it always has been, that we have local control over our public health system, and I am not willing, under any circumstances, to give up that local control to anyone, including the CTC. So we will control that process.
And so there isn't going to be a duplication of effort here. People aren't going to be getting multiple phone calls about this from the city's public health people as well as this organization that the state has put in place.
There will not be a duplication. All of the cases will come in through the Springfield portal. We will then make the decision which cases we're going to keep and which cases we're going to ask the CTC to investigate. The CTC is going to have a very valuable role for us, so I don't discount that, but I've always been a proponent of making sure, to the degree we can, and keep our public health process in place, that we keep local control to the degree we can.
You just speak in general terms about why testing and contact tracing is so important in getting us back to some degree of normalcy.
Sure. So contact tracing is, just by definition, our ability, there is a source. That is the infected person. That infected person has contacts with individuals. And so we talk to the infected person and we say, who have you been in contact with for over an hour and perhaps less than 6 feet? So we're looking for time frames. We're looking for individuals who have been in close contact. Once we have those names, we then call those individuals and ask them, how are you feeling? Are you having any symptoms? And are you feeling anything? Have you been to work? Who have you been around? So it becomes a system that kind of mushrooms out, but it's important for us to have those conversations to figure out who they've had in contact with. So once we have that information, then we have an idea of how prevalent this virus is in our community. There are 2 things. The individual who is the source, or the infected person is isolated. We want them away from sick people. The quarantine comes in for individuals who have been around the source. Those are the individuals that we ask to quarantine for the 14 days, whether or not they have had a positive test or not.
On the subject of testing, last week the Baker administration announced that Quest Diagnostics was going to be supplying testing kits to a dozen community health centers, none of them west of Worcester. I know there's been some discussions with the administration since then, so
That morning, that early morning.
is there a community health center in western Massachusetts, in Springfield, that is going to be part of this testing now?
The Commonwealth did reach out to Caring Health Center, which is a 330 health center in the South End. And so they are asking them to come on as a testing site. And so we anticipate that that will happen. The mayor did call the governor's office once we understood the disparity as we knew it at that time. And shortly after that, we did get the information that Caring Health Center was coming online.
And last question, what's been the holdup with the testing at the homeless triage center?
The holdup has been a workforce issue. When we test, obviously, we need individuals to administer those tests. There has been an internal workforce issue with one of the partners that we use to do testing. And so we're excited that that's going to be resolved. We're also looking at other avenues of creating testing capacity for those populations that we feel are very important to be able to test and kind of rule out or make sure that how prevalent is this virus in that particular population. And right now we're talking about our homeless population.
So you have staff that could do this? What was the workforce issue?
The workforce issue is that COVID-19 brings a set of obvious health concerns for individuals who need to do this kind of testing. Some may be PPE. It could be that it's going to be done at a different work site. For example, our testing we'd like to have done at our tent. And so our tent is not a part of anyone's brick and mortar system. And so there would have to be the opportunity to be able to have those individuals go into the tent. That is outside of a normal work environment for some of our partners, and so that needs to be cleared.
So it was a labor issue?
That's correct.
Organized labor issue?
That's correct.
Okay. But you said it's been resolved?
No, I did not say it's been resolved. I said we are working to resolve the issue, and I anticipate either today or tomorrow I'll be able to make an announcement that we have brought either another partner on board, or we have our current partner is able to do the level of testing that we'd like to have done.
Just to clarify that, when you say, is the labor issue within your partner, i.e. not the city, or is it in-house within the city itself?
Not within the city.
It is not within the
Not
city of
within the
Springfield. It's with one of our partner agencies.
Following up on some of the testing, if at the moment people who are asymptomatic cannot be tested, is there any plan to start allowing people who have been, were definitively identified as a contactee of a positive to begin having them tested, or is that not something that's in the foreseeable future?
Right now, the guidance for testing is individuals who are symptomatic. If there is an individual, we ask individuals to quarantine so that we can have the opportunity to see whether during that 14 days they develop symptoms. Should they develop symptoms, then they will be tested as well. But the quarantine piece is really for those individuals to see whether or not they develop symptoms. I don't have the data that says how many individuals who were impacted by a source or a person with the virus then started to show symptoms themselves. That data is not available right now, but should a contact develop symptoms, we ask them to get tested. The other thing we asked our contacts is to be in touch with your primary care physician. That's critical. It's critical that a primary care physician, we say that to the individuals who test positive as well. Please follow up with your primary care physician, because I don't know, we don't know as contact tracers, even though we ask the question, what underlying conditions that individual may have that may contribute to their healthcare outcome. So we are very clear to follow up with your primary care physician. We say that to the contacts as well.
And one thing, it does seem to be the emerging pattern of where new cases are coming from are long-term care facilities. We don't know this yet, but we've seen other cities homeless, but also overcrowding in a lot of, and I mean not just density, but overcrowding in specific housing. There's an article in the New York Times about Chelsea's problem in particular with this. Is there any step up or any effort to look at where there might be areas of overcrowding in Springfield housing to try to either address or get ahead of any potential uptick in cases in those areas?
We are very fortunate to have a wonderful relationship with the executive director of the Springfield Housing Authority. She has been very responsive as we try to look at the housing stock as far as that entity is concerned. Also, you know that the city of Springfield has a Department of Housing who is always thinking about and working with us to look at those issues related to density and overcrowding. So I certainly cannot stand here and say that there are no issues with overcrowding. That probably would not be a good statement, but I can say to you that we are working with our partners out externally and also internally to the city departments to try to do what we can to mitigate. And mitigate means make structural changes. If there are structural changes that we need to make in order to combat this virus, then the mayor has been clearly open to the structural changes. At this point, we have, again, been working internally and with our part. So that's the answer to the question. I cannot say it does not exist, but I do know that we have great collaborative relationships to try to do the mitigation efforts.
But right now, you're not seeing any particular flare-up in particularly overcrowded areas. You're monitoring it, but you're not necessarily seeing it to the degree that you've seen in Chelsea or Brockton.
We are monitoring it. As you know, the areas of greatest concern tend to be our nursing homes and long-term care facilities. We are continuing to work with them, as is Bay State and Mercy Medical Center as well, working with Springfield Housing Authority and working internally. So we are concerned about our nursing homes and long-term care facilities where we're seeing over half of the deaths, as I told you, 56%, have been in those facilities. And so we're very concerned about those facilities and those individuals. And, loss of life, no matter what age, is a loss of life. And our hearts, we hear the mayor say this all the time, our hearts go out to those families because we know that it's difficult to lose a loved one, just whatever the age. And so COVID has ravaged the nursing home long-term care community in the Commonwealth and around the country.
Any other questions or comments, cabinet heads or? Yes, sir.
question for Commissioner Clapp.
Sure, Commissioner Clapper. Cheryl?
What are your plans for the recruits that you're going to get this week? I know the last ones were, you signed C3, right?
I did, yeah.
What are you planning to do with this
I sat down with the command staff and we used to have a pilot program. The officers would go around to each division and each bureau, and at the end of 1 year's time, they came out a better cop because they have experienced everything. So we came up with what we think is a real good plan to carry the recruits from this coming Sunday to September 4th. They'll spend 3 weeks in different areas of the department. That'll split them up so that they're very manageable. Some are going to the Detective Bureau, some are going to Youth Aid, some are going to C3, some are going to Squad, so that, again, I have the recruits spread out, they'll stay in uniform, they'll learn for 3 weeks that job. That way I have enough experienced officers to make sure they're learning the right way. I have said it before, one of the biggest attributes in policing is experience. So you get a new recruit like that, you want to do things right. So we came up with an over-the-summer plan, which should do two things: make for a real good police officer in September, and help me out covering for vacations over the summer.
How will your, leaving the ones brought on illness aside, assuming they'll come back, how will this impact your staffing levels having this class of recruits?
This will definitely help me, but I've had so many retirements. They're coming in all the time, and some of my people who were sick long-term are about ready to retire on those injuries. So when all is said and done, come next fall, if I can't get another class in, I'll be down another 30, and that's just through retirements.
And last question, when are you starting to use body cameras?
They're starting to train with the body cameras, I believe, 2 weeks. They're in, we're getting the policy set up, a place for people to review the footage to make sure everything is done right. So you'll start to see officers with body cameras third week in May.
Thank you.
You're welcome.
Thank you, Commissioner. Any other questions or comments?
For Pat Sullivan, actually.
Sure. Director Sullivan?
Obviously, a lot of this is going to be contingent on funding, which is really just at the mercy of Congress at this point, I suppose. But is there any ideas about how summer programs might be impacting? We're already hearing from like New York City that they're closing pools and many beaches. I mean, what else that might be? Has there been any discussion or about how that might be affecting Springfield? Are you, where are you on?
Yeah, we are reviewing that. We're watching it very closely. And again, the science and what's happening locally in Springfield will dictate those decisions. So I would say over the next month, we'll have a clear direction of how the summer will be shaping up for Springfield.
Is there any thought of like closing similar facilities for the summer, or is that really?
Again, it depends. It depends how the virus is operating in this area, and we'll be working closely with our health department, the mayor, and just seeing what's happened across the Commonwealth.
Thanks, Pat. Any other questions or comments? Okay, hearing none, I really thank each and every one of you and the media for getting the word out. And I want to thank the residents and the business community for their understanding, their patience, and their cooperation. As we have done with these past challenges or natural and man-made disasters, we're going to let you know what has occurred. We're going to let you know what we're going to do about it. And just as importantly, we're going to get through this, the sign of hope, together as one and for the better. If anything else should arise, we will send notice out, whether it is written or verbally or another press conference, whether it's another challenge or good news. As always, we will be back here every Monday at 10:15 and we will defeat this COVID-19 coronavirus with my dedicated and hardworking cabinet heads, and a big thanks out to the rank and file and Dr. Kerouac, the President and CEO of Bay State Health Systems, and Dr. Robert Roos, the Chief Medical Officer for Mercy Hospital, Trinity Healthcare. Again, to the sign language specialists, the lovely young ladies, the trifecta, thank you very much for being here. And to the media again, thanks for being here. Thanks for getting the word out to each and every one of our residents and business community. So we start to see some light at the end of the tunnel. Helen and I want to do much, much, much more testing, and we have made that diplomatically, aggressively, strongly put forward to the federal level and the state level. And then we're working on, in the very near future, we're hopeful with Pat Sullivan and Director Helen Carlton-Harris on some type of reopening of City Hall and our city buildings. And then we are awaiting, which I believe, in my discussions with the governor, lieutenant governor, that you might see some type of announcement coming from the governor sometime this week on how to proceed with some type of staged or phased opening of businesses. But like him, I'm in the same boat. It must be done. It must be done on medical, science, and health basis first, and we have to continue to show, to build confidence, public confidence, business confidence, consumer confidence. That's why the testing, contact tracing, isolation, identifying, and community mitigation, that we are able to find that area, hotspot area, deal with that hotspot area, and work in conjunction with our hospitals, in this case, Bay State Medical Center and Mercy, that if, I'm knocking on wood now, if a surge was to occur, it can be dealt with. We're learning from what happened not only across some other United States of America, but other countries in the world, my beloved homeland of Italy, on if the hospital and medical establishments cannot handle the surge, it starts to defeat the purpose on it. So we don't want to take one step forward and end up taking 2 steps back. So we're working as hard as we can to not only get city government fully open again, though we are working to the public. We miss you, we want to see you, but we also want to see our businesses reopen as soon as possible, and as long as it is safe and sound and healthy to do that. So everybody, stay healthy, and God bless you and your families, and God bless the city of Springfield. Thank you so much.